Hello, everybody. Welcome to the Dental Ailments Podcast. It's been a while since I've hosted because my fearless cohort, Cindy's been doing a couple of the shows. And this one today, we think is a pretty special episode. The guest we have on today, I'm going to introduce Dori Bonner. Dori has an amazing story, and she's going to talk about her son. Help me out here, Dori. I'm going to mispronounce it.
Epidermylosis Bullosa.
Thank you. And Dori's going to tell her story about that and something that it should be addressed as dental professionals, the lack of care for this disease. And we also have Frank Dreyer. He is part of Emident, and we'll talk about a little bit about that. We have Stacy Carnes on the show. She is a dental hygienist who has worked with Emident and special needs patients. And then, of course, we have Cindy. So, Dori, go ahead and tell your story, how your son and his oral care and the lack of oral care, finding professionals that can help your son, and what you feel we need as dental professionals to improve upon.
Sure. Hello, everybody. My name is Dori Bonner, and I have a son named Solomon who is almost 6 years old, but he's 5 years old right now. He has a rare skin disorder known as EB skin disease, Epidermylosis Bullosa, but sometimes people refer to it as butterfly skin because his skin is so fragile as the wings of a butterfly. And in fact, physicians actually refer to his skin disease as the worst kind of disease you have never heard of. So he is so fragile that when he was born and I was holding him just without blanket, his back looked like somebody had scratched him completely, and I wasn't doing anything but just hold him. So when I was nursing him, the layers of his tongue was completely impacted by that. He was growing blisters on his tongue. Eating anything impacts the tissues inside of his mouth. So with that goes also dental care. Now that he has teeth and he's eating food and we try to brush his teeth, we were unable to brush his teeth because his gums would blister. And to this day, like I said, he's almost 6. To this day, I have not been able to feel comfortable to take him to a dentist, because I think it's important to mention that we are a military family, so we move every 2 to 3 years. And no matter what part of the country we moved to, we were stationed at the Pentagon, so we lived in Virginia, which is huge. I was never able to find a dentist. I made calls after calls, but I never was able to find a dentist who knew about my son's disease. So I was always very intimidated and frightful to take him to someone who didn't know about his disease or understood just how fragile he was. So, yeah.
So, Dori, hearing your story, like Dr. Mark Cannon had said, he works with EB patients. He says, as healthcare professionals, we go in, we put on our capes, and our hope is we can help everybody. And here's a situation where, like, wow, we put on our cape, but we don't have the tools to help like we should. I thought that was pretty powerful when he said that. And then, after we heard your story, I'm like, we're all like, we've got to bring awareness to this. Everybody deserves the oral care that they need.
Absolutely. I couldn't agree with you more. I think that sometimes I am, even now, actually, to be honest with you, I'm so emotional about this because at minimum, I think that they deserve oral care. At minimum.
Right. Now, Cindy and Stacy, hearing these stories, and I know Stacy, you've worked with the brush and we've all worked with special needs patients. I mean, hearing this, what was your first thought?
Well, it breaks my heart. I mean, it truly breaks my heart that there is a disconnect between medicine and dental, that we wouldn't be working collaboratively for the physicians that Solomon sees to have, a referral source for Dori to be able to take Solomon to. That. I mean, I can't even imagine. I have a child who was born with a white blood cell disorder, and I know that my physician got right on to referrals for him, but had he had issues with his teeth and his mouth, I would have relied on the physician to help refer us to a dentist. I just can only imagine the frustration she feels.
If you don't mind backing up a little bit and talking a little bit more about this disease, because I really, like you said, I've never heard of it before Frank told us about it. So I'd like to hear more about that if you don't mind as well.
Sure. Basically, Solomon has a protein in him that is not functioning the way that the protein in my skin or your skin or someone else who doesn't have EB. So this protein essentially acts like a glue between the different layers of the skin. So when he has trauma, for example, and trauma for him could be, let's say, falling off of a bike. And so the entire skin from his knee will completely tear because the glue in the skin isn't strong enough to hold it together. Similarly, he gets trauma blisters because even if he accidentally bangs his hand, let's say, against a desk, as you might imagine a crazy 5-year-old boy might do, he grows huge, giant trauma blisters that we have to lance using medical needles. Otherwise, these blisters will just grow and grow and grow. And most times they're filled with liquid. Sometimes they're filled with blood. And so I feel like the reason why there isn't a lot of awareness in the oral care for these patients are that they are just trying to keep them, I think families are just busy trying to keep up with their bandages and just trying to keep them alive. And it's almost like there isn't, I don't want to say that people feel like they're not important enough, but there isn't a lot of awareness about oral care and EB because there are so many other things about this disease that is so dangerous that that's like the least bit of their concern. But it shouldn't be that way. I mean, as a mother, it bothers me that I don't know, when I take my older son to a dentist, Solomon says, "Mom, can I go to the dentist?" I am never able to give him an answer other than a lie as to why he cannot go to a dentist. And that bothers me a great deal. I mean, even until I found Emident toothbrush, every night when his older brother would go to the bathroom and brush his teeth, Solomon really, really wanted to go and have that experience with his older brother and brush his teeth. But we could never give him that, that freedom because I was afraid he would hurt his gums. And so one night, after I found Emident toothbrush, he was in the bathroom and I handed him the toothbrush and first I tried it on myself and then I gave it to him and I said, "Well, this is how you brush your teeth." And he said, he just looked in the mirror and he was like, "Oh my gosh, look, I'm doing it. I'm brushing my own teeth with my brother." He was just so excited. I want to give him that experience when it comes to going to the dentist. I want him to be able to experience normalcy like his 8-year-old brother.
Hearing that's things we take for granted. We brush our teeth every day, not even think about it. And as oral care, healthcare providers, I'll admit, I didn't even think about the fact that gum tissue can slough off, the corners of their mouths can get sore. It's hard for them to open, for example. So taking those special precautions, and I know we talked about also the instruments we use in dentistry, making those more friendly for treating them. Like you're saying, even the home care is something you really have to think about, being really careful.
Yes, so I think what I was going with that is if I am that afraid at home to let him go to the bathroom and hand him a toothbrush and brush his teeth, the toothbrush is not as scary looking as some of the tools that they use in the dentist office. I certainly couldn't feel comfortable to take my kid to a dentist who has no idea how fragile my son is. So, especially I'm not sure what they can come up with, but I feel like if at minimum the doctor knew about how fragile his gums were, I would be more comfortable to at least take him for a regular checkup.
So Dori, has he ever been to the dentist before?
No, never. And that's on our list. I have a list of things that I want to do, that I want him to experience. And can you believe that visiting a dentist is on his list? It's kind of like a bucket list for him.
Wow.
So for us as oral health care providers, when I hear that, the thing that strikes me the most is that we all know that the mouth is the gateway to the health of the rest of the body. And that's the part that it's a stumbling block, because you feel like you can't find a provider that would be safe enough for him to visit. So, I mean, have you, and this is just me, I'm wondering, I mean, with teledentistry so big, have you thought of finding a provider who provides teledentistry, and you could do kind of like a Zoom call meeting with the doctor, and Solomon could meet the doctor over a Zoom call?
So I guess this experience I'm describing before the pandemic happened and before all these other options became available to us. Certainly that would be a wonderful thing for him to do. I think that's a great suggestion. We moved here in Tennessee in July, and I spent probably until September making phone calls around, all the way to, like, I was willing to travel all the way 4 hours, 5 hours, it didn't matter what. And I was never able to find anybody. I just repeat the same thing over and over again. Do you know about this disease? I have a son. Could you see him? And they would say, I will call you back. And they would call back and say, we haven't heard of the disease, but we'd be really careful with them, things like that. But I haven't been able to, I'm too afraid to take them.
Yeah, because most people don't really understand when you say that, because we do see patients with sensitive gums or things like that. So we could be like, oh yeah, whatever, we'll be careful, but it's what you're saying is like super serious, and we can't just go in there and perform normal prophies like we would, even with sensitive patients. Tissues would just slough off, right?
Yes, I think, I came to this conclusion once he was little and he was up for his vaccinations. Before I took him to that office, I called in advance and reminded them this kid has a special disease. And so he was receiving multiple shots at once. And I mentioned to them, you are going to need 2 people to administer the shots at the same time, because once he feels one shot on one side, he is going to wiggle and do all kinds of stuff, and he's going to get injured. And they said, okay, no problem. But when we went there, I guess they only had one person. And sure enough, by the time we left, his pant legs were bloody from blisters he grew immediately and from getting injured because he was kicking them as they were trying to administer the vaccines. So there's no way that I could ever feel comfortable going to someone who is clueless about how fragile he is.
Yeah, so like what Stacy was saying, I think teledentistry would be great. And now he won't feel so, special, because everybody's doing that too. And for him to be able, for a dentist to be able to see, and a hygienist too would be great, and an assistant to be able to see what it really is before they have him come in. And then that way they can do some research as well, actually meet him and, look at his gums, and you can explain it a little bit more that way. With the Emident, can you tell me a little bit more about that? I've met Frank before and I've seen it before, but I'd really like to actually know more about it, because it sounds like it's something that's really could be really amazing for a lot of patients, really.
So I'll just quickly tell you, I know I touched up on this earlier, but when we moved on this base, it's like a village, living in a village. It's a closed community, military community. And so Solomon was going around telling everybody, hey, guess what? I'm brushing my teeth on my own and my mama doesn't help me. And, him being 5, everybody was looking at him like, okay, they were confused about this statement until I mentioned to them why he was saying that. Until he was 4 or just about right before I met Frank and found Emident, the number one wish he had. So I would ask him, what do you want for Christmas? Or what do you want on your birthday? And I would write it for him. He would always say, brush my teeth on my own without you watching me. Aww. And it was always on his, right? It was something he wanted to do, this experience with his brother, who was like his hero. And then I eventually, I was desperate one night. I felt so bad for him saying that. And I'm just Googling all over the place. And I come across Emident toothbrush. It was like, oh my goodness, how on earth is this even here? And I don't know about it. I remember purchasing it, and it was like in German dollar, and I did not even translate it into the English money, to the US money. I just purchased it, and then later on, it was like, okay, it doesn't matter how much money this is. So with Emident toothbrush, I will let Frank explain to you why it works as well as it does for Solomon. It is like his dream.
Thank you, Dori. And I was really shocked when we talked about, because I had no idea. Like you said, this is a disease that we have not heard about before, and there's more than 20,000 people in the U.S. alone that have it, and so it's not like it's ultra rare, but it's certainly something that is not as commonplace as maybe other things. And I was really, really happy to see that that the Emident can actually help with oral care, provide the first steps of oral care as part of an overall routine for Solomon. Now, what's special about of the Emident is that it doesn't clean by brushing, even though it's a toothbrush and it looks like a toothbrush, but you do not brush at all, because it doesn't clean with abrasive brushing, but it uses ultrasound waves. So the ultrasound technology we're all familiar with. It's used in the dental office. It's used in many places for cleaning, because it cleans touchless. And the ultrasound technology is customized for oral care cleaning that you can do at home. So instead of brushing, you turn the device on, you just put it next to teeth. You can put it next to the gums, and you just hold it still there. Don't brush, just gently touching the surface, and the ultrasound waves together with the toothpaste will do the cleaning. And that, of course, is super beneficial when you have very sensitive skin, very delicate gums, when you have receding gums, when you have even fresh oral surgery. It really helps you to clean when you can otherwise not clean, when you don't have other tools available. So I'm still super happy, and that's why we really wanted to we're super happy that that the Emident is helping your son Solomon, and that's why we wanted to bring more awareness, so people understand there is a tool that can help when you don't have other tools. And I think Stacy, you had some patients that were using the product as well, and have some firsthand experience there.
I do. So I'm a dental hygienist. I've been in practice for 30 years, and the last 5 years, my concentration has really been in a perio setting. So the majority of our patients, they come in and they are unhealthy, and it's our job to try to help them achieve that state of health. And when they go through surgical procedures, there is a time period where they cannot brush. It can be anywhere from a week, 2 weeks, up to a month at a time. So you can only imagine that if your diet is soft or just liquidy, that there would be a lot of things that would, be on your teeth. And after a while, just wiping with gauze is just not enough. The other thing is, when patients have those fresh wounds, you want to make sure that you don't have a high concentration of bacteria there, because then it's going to delay the healing process. And the thing that I found was that it was funny, because we would send people home and say, hey, use this ultrasonic toothbrush. And I would be like, why would you send someone home with that? That was going to damage, the tissue that is fragile right now. Or I also have patients who are not quite ready for the surgical procedure, and we really had to work on home care. They come in and their gum tissue was just so fragile because of the disease process. And there was no way that they were going to be able to brush at all, because that would hurt, that would be very painful for them. So I started recommending Emident when I met Frank a couple of years ago, and I have seen the healing that has occurred using this product. And it's kind of like a miracle. It's a miracle brush, right, Dori?
Absolutely. In my son's case, I truly mean that from the bottom of my heart. It was a miracle, not simply because of what it does for his teeth, but this simple freedom of being able to brush his teeth with his brother. You cannot put a price on that.
That's true. You gave him the gift of independence. That's awesome. It makes mom's heart so happy.
I just had a couple more questions, just because this is my first time learning about it. So I know that everybody else listening too is going to want to know a lot more, if you're okay sharing. I know Stacy was saying something about wiping, patients' teeth with gauze. Are you able to do that even with his teeth? Or
yes, I could. So some of these kids who have Solomon's disease, there are different degrees of the disease. He's considered mild, but there's nothing mild about it. So some kids who have different kinds of, similar disease, but a different variant of it, their gums are even more delicate than Solomon's. So Solomon is able to eat solid foods and essentially is normal, except for the fact that he's so fragile. So if I rub my fingers across his gums, as long as I'm doing it gently, that all is fine. If I use, before Emident, I would use my fingernails just to kind of scrape off some things from his teeth because, I wasn't able to use a toothbrush to do that. So I am able to do some of those things. But even if I found toothbrushes with soft bristles, it was still too rough for him.
Yeah, and it's really hard to find toothbrushes with soft bristles anyway. Yeah. But then, and especially a 5-year-old, they're not going to brush gently. And you really need to, the hygienists, us dental people know that the bacteria goes up under your gums. So really you want to brush under your gums. And, obviously you can't do that. He's going to be losing his front teeth pretty soon. Has he lost his front teeth yet?
Not yet. We are waiting on that. But when he was getting his baby teeth, initially a tiny little blister would form on his gum. And that's how we knew he was about to grow a tooth. And then we'd see a little, tip of a white tooth coming out. But he hasn't lost any teeth yet. And to be honest with you, my husband and I recently spoke about this. We're not super concerned. I'm sure this is fine. But it's almost like these teeth are there to stay forever. There's no indication of them coming out anytime soon. I don't know if that's normal, but I would love to be able to see a dentist.
Oh, so he hasn't had a panel or anything either. Yeah. Things we take for granted, because usually we'll do a panel so we can see, just to see if they're permanent teeth, they're up there and how far, or if they're missing any teeth.
Yes, correct. I actually can't even take him to a hairdresser. When you say that, it reminded me of that. I'm not sure, I can't even take him to a hairdresser. I cut his hair for him. So, but this is one area. I've almost been able to adapt to all of the things that he needs. So I am that person for him, the nurse, the hairdresser, and all those things, except when it comes to this, I just don't have enough information to help him with his dental care.
So Dori, speaking from, the clinician standpoint, I know that in our office, we have intraoral cameras and they're cool. Some of them are the size of like a pen, and we can use that to do an evaluation without, being very traumatic or anything for him. If he could just open up wide, we can take intraoral photographs and do a great assessment that way. And like Cindy said, a pantograph is great because you're not actually sticking a sensor or anything in the mouth that could cause trauma. It's just a little stick that he could bite down on. Machine would go around, and then you could see where he is developing and see all those new little teeth that are, they're ready to come. That would be fantastic.
We could use the Emident, right there at the practice even to brush his teeth for him.
So Dori, for others that are listening, because I went in and did a little research myself because this was so interesting to me, that there are a lot of secondary issues because of the EB. I read about acid reflux. They're very prone to cavities and stuff like that. So what is your experience with Solomon and other children and their oral health care conditions?
So we don't give him a lot of food with, acidic kind of foods. We just don't give him that. I feel, actually his digestive system was kind of impacted. When he was younger, he would have such a hard time with constipation. I have seen his wounds that are so bad, and I've always been able to just kind of get there and just do what I need to do, even though as his mom, it would break my heart. But I would go in and wrap his wounds no matter how big or small. When it came to him being constipated, I just couldn't handle it. I would feel so bad for him. He would be on his fours, just get on his elbows and knees and cry and try to push and do all kinds of things. And so yeah, he's better with that now because I basically give him such a good nutritious food all the time. We try to avoid candy and acidic kind of foods. So we're really proactive with all of that. Thankfully, I haven't had any issues with any of those. with him.
That's awesome.
Yeah.
You said he was okay with eating solid food. Is he okay to chew?
Yes. So he wants to eat, of course, he knows that he's not supposed to have Doritos. So that is one thing he wants to eat all the time on Friday night. We're sitting there watching TV. And so I would break it in small pieces, almost like if you're giving it to a 1-year-old, like for choking hazard. But for him, it's because I don't want the pieces to be so big that would hurt his gums. And so we rarely give him things like that. He wants, for example, he wants to have popcorn, but I might give him a few pieces, but the entire time I'm sitting there and just my heart is racing, So he is able to eat solids in the sense that other kids who are worse than him would never be able to experience food in the way that he experiences it. But he is not able to experience it in the way that you and I can.
So Dori, in the research I was doing as well, talking to the University of Minnesota, their med school sounds like they are working on hopefully cure for EB. And in the process, they're working with the pediatric dentists at the school. They're known they bring in patients with EB from around the world, they were telling me, to help out these kids. And then there was Dr. Mark Cannon, who is a pediatric dentist as well and works with these kids. And they have some literature out to hopefully have these dentists get an idea to help with these kids, to what kind of instrumentation, for example, and preparatory work to help to have them be more comfortable during procedures. So we're hoping to get the word out for them and have the dentists be more aware of what we can do.
That is amazing. That would be like a dream come true. I wish that they would, I wish that every dentist, when they go to school, that this would be just standard practice for them, just maybe like one day of learning about this disease. I would just love that for them.
I saw there are some foundations out there. I'm sure you know that as well, such as Deborah and the EB Research Foundation.
Yes.
Bringing awareness to this as well. Hopefully we can get in touch with them to talk more about this, bringing their oral care needs to the forefront as well.
Yes.
Dori, what would be a request that you have if you were to talk to a dentist or dentist office? What would you want them to know? What do they need to be aware of? Because what we've been talking about right now is like all the things that we take for granted, you cannot, and you can no longer. We don't even think about what you cannot do. So what is it from what you know now, what you would tell a dentist and what they should, and a dental hygienist, what they should be aware of and what they should do, and especially what they should not do?
Well, I feel like, they're such professionals. So I wouldn't even know what to suggest for them, but I would just want to be able to, my son's disease is so rare, but he still matters. So, my thoughts are always that I don't blame them that they don't know about this disease, but I wish that somehow I would be able to just take my son to someone who would, sometimes I have taken him to places like just regular physicians for his regular checkups. And they think that I am being overly paranoid. They would always try to tell me, oh, it's okay, Mom. I promise you he will be okay. And I feel like they think that it's me who is paranoid because they don't really have a good understanding of his disease. It would be my dream come true, and also his, if we could simply call a place and they say, oh, we know about that disease, but, bring him in, and they have a special kind of tools for him. I'm not sure what that would look like, but just things that are EB friendly, that would make me feel comfortable to take him in, and where he's also comfortable and not afraid. But two, if there are parents listening to this podcast, last week, one of our neighbors in the village said she was feeling so bad, for her son, that she had to take her son to the dentist. It was one of those appointments. She's like, and nobody wants to go to the dentist. And I just looked at her, but I didn't say anything. But what I wanted to say is, you have no idea how lucky you are to be able to just say that, to be able to take your kid to the dentist and not worry. So if there are parents listening, be grateful that you can take your kid to the dentist.
Have you ever taken them to, like when you do take them to the doctor, where they can put them under anesthesia and do some cleaning or oral care that way?
No, I haven't. But that anesthesia part is a whole other can of worms. That's probably a different podcast. But no, to answer your question, no, I haven't.
Yeah, I'm sure, because we're talking about his mouth today, so I'm sure you have all kinds of other stories for other professionals. So
yes.
Okay.
Well, Dori, we're gonna try our best to bring awareness to this into the dental industry. It's gonna probably take a village, but we're gonna do this.
Thank you so much, April. I am so grateful to all of you. I remain grateful and truly grateful to Dent. And I also am so thankful to you guys for doing this. It's so special that you're taking your time to do this. I appreciate it.
Absolutely. Our pleasure.
April, would there be an opportunity if you reach out to the listeners and see, well, we are an office who would like to know more about it, and where we could possibly help with education, or maybe establish a link with Dr. Cannon or to others. So it's either, or what Stacy, you recommend, there's a tool that we can possibly use, that we could even create something like a guideline that we could post and say, here are the 10 things that you should know, that you should be aware of. Maybe 10 things is even too little. So we can provide proactive help, not only telling what EB is, but what the dentist office should be aware of, what they should do or not do.
Yeah, we're going to start right away working on a blog and an article to get the word out there. And then also we could work on possibly doing a CE course together on something like this to spread the word, because it's something that needs to be learned. And it's new, it's new information that it should be shared in the dental community.
Absolutely. So we'll get the word out, like Cindy said. As a collective, we'll get in our different dental groups, LinkedIn, whatever it takes, and social media to bring light to this. Any final words for anybody? Oh, Frank, you mentioned something about a raffle. Is that correct?
Oh, thanks for reminding me. Well, what we are offering is, since now many of you have heard about Emident and about cleaning with ultrasound, which sounds all very magical. How can that even work without brushing? So what we are going to do is we will raffle a couple Emident starter sets, so fully functional, brand new Emident devices. So whoever is listening to this podcast, contact April, contact Cindy. We'll provide the contact information separately, and we will raffle amongst you then the Emident devices. You can then experience it yourself. In addition, we will also create a special offer for the viewers of the podcast, which we'll communicate separately. So you will be able to get access to the product at very special conditions that are not available to others.
And hey, another thing we could add on there, April, just for the listeners, this product is for anyone, and we would love to help get the word out into the medical field as well, so that these nurses and doctors know that there is a product like this. And Frank and I, every month, we do a webinar, a medical or dental professional webinar. So we teach about this, and we always refer and we talk about Solomon and his condition. And that's just part of our webinar, because we want to get the word out about it so that they understand. And so if anybody is looking for, some education from us, we were happy to have a Zoom call or webinar with them.
And just sorry, I was going to mention to you, if you ever need Solomon or me for any of these things, we would be happy. Frank knows Solomon is quite a charismatic kid. He always wants to be a YouTuber, so he's always available.
I was going to say, I'd love to meet Solomon and have him. If you could share a video with them or some pictures, we would definitely love to share it on our site and with others, and so they can see we're not just talking about a disease. We're talking about a little boy.
Right.
A little person, a little boy.
I would love to.
Just like all little kids, mostly now.
You should get Solomon's autograph right now.
He has sent a video to Frank.
We have already a wonderful video of Solomon that Dori recommended, and where he actually asked, "Put me on YouTube." So we'll share that.
You know what? That's not a bad idea. That is a really great way to spread the word.
It would be. Solomon, the spokesperson.
Yeah.
Yes.
He would love it. We are thinking about it. I think that would be a great way to just, like you mentioned, just put a face with this disease. We are totally thinking about that.
Yeah. And then not only did he get to go to the dentist, he got to help other people go to the dentist and get oral care and be able to brush their teeth or wave a wand, magical wand. One other question for Frank about the Emident. So, Dori, how long have you been using it, did you say?
It's been over a year now.
Known in Germany, right, Frank?
Yeah, it is. It's already in the global market since about 10 years. That's when the company created the technology and actually patented it, because it's not as simple to produce as people might think. And we've just entered the US market a couple of years ago, initially focusing on reaching out to the dental professional, simply to educate them about a new technology that's out there for cleaning. And actually the technology is not new because we all know how ultrasound works. It's just new in the context of an alternative to toothbrushing.
Yeah, I love it. It's time we catch up and spread the word here. So I'm really excited for everybody to learn about it and have it available.
We're just happy that, there is no one product that is solving all your world's problems in oral care. Of course not, but it's an additional tool that is available. And it's a tool available for people that currently have problems, challenges, or even are unable to brush their teeth. And so that, of course, is something that is, it's great when you have in your arsenal an additional tool that you can use as alternative, or in some cases, as we've seen with Solomon, as the only tool that you can use to get a better oral health status. And if he can do that, that's just great, and that's a part of the mission that we're out for.
Well, let's get Solomon to get his little superhero cape on.
We'll do that.
And we'll get him to, yes.
He would love it.
Well, guys, any other comments, questions?
Dori, thank you for sharing your story, your family story with Solomon. We want to support you and help you guys out. So it's an honor and a privilege to get to know your family, and we are going to work very hard and very diligently to spread the word.
Solomon is outside right now playing, and he's just going to be so thrilled when I tell him about our discussion. I'm always telling him, in fact, before I came onto this Zoom call, I explained to him what we were doing, and he was so excited. And he's, all of us appreciate all that you guys are doing for us. So thank you so much.
Thank you.
Dori, maybe one last thought, and that's one that would go out to the listeners of the podcast. Where do you live, Dori? Maybe we have a dental hygienist, maybe we have a dental office that listens to the podcast and says, you know what, Dori, come in. We will educate ourselves, and we will be the first dental office that will provide care for Solomon.
Oh, that is such a great point that you just made. So we just, like I mentioned, we moved at this Air Force Base called Arnold Air Force Base. It is in Middle Tennessee. So I am near Kentucky and all of those great states. But I am an hour and a half from Nashville. I am hoping and praying that someone might be able to know, someone familiar with this disease might reach out. I would probably cry.
We'll put the word out, see how we can find you some help, or somebody that's willing, like Frank said, willing to learn, or maybe they already know about it, and get Solomon some dental care.
Oh, yes.
Yeah.
That would be amazing.
Right. Well, ladies, Stacy, Cindy, and especially Dori, thank you for coming on today. Dori, you always have inspiring stories. So happy that we all connected.
Thank you so much.
And Frank, we can't forget about Frank. Thank you for coming on, Frank, and telling us about Emident and how it can help our patients that need it.
Thank you for having me.
All right, everybody out there in podcast land, thank you for listening to Dental Ailments. And we will be posting some links for EB, how to find these suggestions on how to take care of, help with the oral care for EB patients. where you can find resources for example, the University of Minnesota's Pediatric Dental School and the foundations that, such as Deborah, that can help out EB patients as well. We'll be posting about Emident and the raffle, and let's get the word out and awareness to this disease.